Do you think that if you are outside and not close to people, you still need to wear a mask?
You know, this is a question that we're looking at. One of the things I think that's really important to understand is while there's wonderful news and we're getting more and more people vaccinated every single day, we still had 57,000 cases of COVID yesterday. We still had 733 deaths. And so while we are really trying to scale up vaccination, we have this complex message that we still have hotspots in this country. And we will be looking at the outdoor masking question, but it's also in the context of the fact that we still have people who are dying of COVID.
That's CDC Director Dr. Rochelle Walensky yesterday on the Today Show, talking about the debate over whether people should still be mandated to wear a mask outside. Joining us now, physician and fellow at the Brookings Institution, Dr. Kavita Patel. She's a former Obama White House health policy director and an MSNBC medical contributor, and writer and reporter for the New York Times, David Leonhardt. Good morning to you both. Dr. Patel, let me start with you. It was something to watch Dr. Walensky kind of hem and haw over that question. Is there any scientific evidence that shows not wearing a mask far from other people outdoors is a risk of COVID-19?
Yeah. Hi, Willie. Good morning. I've rarely seen an issue that divides the public health community so fervently as this one. But there is, to your question, there is very little scientific proof that if you're outdoors and you're not symptomatic and you're distanced and you do not need to wear a mask, that the risk is very low. Infection transmission has not been recorded. So I have not seen any evidence of it. And it's why I've been telling people pre-vaccination, post-vaccination, if you're away from others, you do not need to wear a mask. However, we still have a lot of factors going on, such as community transmission. We've got places where cases still are rising, and we have the threat of variants, as well as the fact that we still only have about half the population vaccinated. So today, I think it's very reasonable, and I wear a mask if I'm in an outdoor space, but with kind of crowded people, kind of a rally or an outdoor concert of some kind, and I know that I'm not going to be able to reliably keep distance from people.
So is the CDC not saying that clearly because there's a messaging problem, that they worry that if they say, you know what, you don't need to wear a mask outside as long as you're distanced, that the American people will hear you don't need to wear a mask at all, outside, indoors, anywhere? Or in other words, why won't they just come out and say, look, if you're out for a run, there's nobody around, you don't have to have your mask on?
Yeah, I think, Willie, honestly, I think it's part the messaging. A lot of it is the science, because I think we're looking at cases. If you look at Israel, they dropped the outdoor mask mandate, Willie, only when they went to barely any cases and about 85% of their country being vaccinated. So I'm just using that as a milestone. The CDC is also looking at data kind of daily with 100,000 case rates. And I think the fact that you mentioned is really a critical one. If they send a signal that, quote, outdoor masks are not necessary, I've had the very conversations with mayors and governors who have said, well, what constitutes outdoors? And then there becomes kind of this issue of scope creep. What I'm worried about more, I'll be honest, the outdoor mask debate, I'd much rather replace that with the indoor mask debate, which is still being debated, by the way, in some states where they do not have indoor mask requirements. And I would plea and beg to say, at a minimum, make sure that we have indoor masking until we get to a certain level of vaccination. And I'll just add that I'm watching what's happening in India and other countries. The threat of kind of concerning variants does not escape any of us who study public health. And as policymakers, which is what the CDC has to think of, their job is ultimately to protect and mitigate risk. And to be honest with you, Willie, I don't know how wearing a mask puts you at that much risk or is that much of an imposition. I understand it's not convenient, but it's certainly not a big intervention in the big picture.
I want to get to David in just a second, but since you mentioned India, my goodness, the scenes we're seeing out of that country are just breathtaking. The numbers we're seeing are breathtaking. What is going on there, and is there any lesson to be learned for us here?
Yeah, I've actually had family almost on a daily basis. We have large families still in India. I'm a Patel, and almost every day I'm getting a call that someone's died or asking if I have a connection that I can send remdesivir or steroids. And so it kind of breaks my heart to think about, how much we have and what they don't have. But for lessons learned, a couple of things, Willie. We thought India would escape the worst of it just because we hadn't seen the numbers. And it just reminds us that even though we don't see some of those numbers in places like Texas and other parts of the country right now, it's entirely possible we could get there if we don't make sure we deal with people who do not want to get vaccinated. The second lesson really is around public health infrastructure. I heard your coverage of kind of Biden's infrastructure bill around healthcare. I will tell you, India, world's largest democracy, the public health infrastructure is virtually non-existent, especially in many parts of the country. So it's another reminder that these are investments that have to be made, that need to be something of a global investment, if you will.
Yeah, there's some talk that the United States should send surplus vaccine to India to help stem this terrible problem. So, David, you're writing about all this irrational fears in America around COVID, outdoor masking as well. There is a sense that people are afraid to step back into normal life, as much as we all say we want to, and we do want to, that taking off the mask, even if you're out for a run, or maybe taking it off while you eat dinner inside, is a violation of these things that we've come to accept as necessary to get us through this.
Yeah, I think there are a few things going on here. I mean, one, I do think the public health messaging has been off. Look, there isn't a single documented case that I'm aware of anywhere in the world of brief, casual outdoor contact, like passing someone on a sidewalk, leading to transmission. None. Right. And so this is a tiny risk. And I understand why the CDC often wants to be extremely cautious, and they want to do studies first, and they never want to say anything that might lead people to take more risks. But I think public health messaging should trust people a little bit more and should basically say, look, you do not need a mask outdoors. If you want to wear one outdoors, that's fine. If you're in close conversation with someone outdoors, you should wear one. And you really, really should wear one indoors, because I think people will be more likely to listen if we're honest with them rather than always kind of dialing it up. And part of what's going on here is people are very afraid to take any risk, but we take risk every day in our lives. I mean, we get in cars and we eat food, which we could choke on, and we go swimming. And so I think it would be really helpful if we started treating people a little bit more like adults than the CDC has been doing, and saying, look, the risk of this is virtually zero, so you can feel comfortable with it. These other situations are truly dangerous. Please, please, please wear a mask indoors absolutely as often as possible, especially if you are not vaccinated.
David, Jonathan Lemire is here with a question for you. John?
Hey, David, I wanted to ask you a little bit more about your piece. You started with a professor who says he talks to his class every year with a specific allegory, and in this case relates it to COVID-19. Can you walk us through exactly that example and what sort of broader lessons we all should be taking from it as we do debate this moment now about how to go about in a world where some people are vaccinated, some are not, some are wearing masks, some are not, as we're all trying to somehow get through this pandemic, and as we see an end stage hopefully just a few months away?
Yeah, I love that fable. So it's Judge Guido Calabrese, a federal judge and a longtime Yale Law School professor. And he has a class, and he says to his students, look, I want you to imagine that a god comes forth and offers society a wondrous new invention. It makes your life better in almost every way. You can have jobs that you couldn't have had. You can spend more time with friends and family. But there's a cost. And the cost is that this God is going to strike down 1,000 young women and men in exchange for the invention every year. And he says to the class, would you take it? And almost invariably they say, no, we wouldn't take it. Well, that's not worth it. And then Judge Calabrese says, well, what's the difference between this and the automobile? Automobiles kill 40,000 Americans a year. They do make our lives more convenient in every way. And to me, the lesson here is when we're confronted with a new situation, a new risk, we are extremely cautious. But there are a set of enduring risks that we've just come to live with, like the automobile. And we're in this funny case with COVID right now, which is COVID has been horrible. It's been the worst infectious disease any of us has ever lived through. But for vaccinated people, the risk is actually tiny. It's tiny of getting it. It's even smaller of getting sick. It's tiny of infecting others. And so we're going to have to start to moderate our behavior and say, look, the risk is not zero if you're vaccinated, but it's so low that we should start to think of it more like a shark attack or a lightning strike. And we really do need to start doing some things again, because I'm really worried about the effects on kids. I'm worried about the effects on low-income people who can't work if we don't get back to normal. And that's why I thought of the fable this week.
Yeah, it's a great one. 89 million people, you can see on our screen, are fully vaccinated in this country. 200 million vaccinations passed that milestone this week, but still a long way to go. Just over half of the country's adults have been vaccinated. David Leonhardt, Dr. Kavita Patel, great conversation. Thank you both for being here this morning.
Hey, thanks so much for watching our YouTube channel. You can follow up on today's top stories and breaking news, or catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.